Today we want to do cannulation. So to cannulate, we want to put a cannula on Mr. Mlenga's arm. So let's start the O square. Start with hand washing. So 1, 2, 1, 2. Okay. So you go, you dry your hands. As you are drying, you have to be getting permission. Good afternoon, Mr. Mlenga. I'm student number 2. I've been assigned to do cannulation on you. May I please go ahead? Okay. What about where you're sleeping? How is it? So you have to take a look. Okay, it's okay. I'll be right back. Let me just prepare. So as you prepare, you're supposed to come and get methylated spirit. So this is a methylated spirit, which you're going to use to clean the hand. Okay, so you pour there. So this label has to be in your palm like this, and then you can pour like that, just to make sure that you don't spill spirit there. Okay, next thing you're going to do, you're going to get the incontinence sheet, because you want to spread under his arm. So this is an incontinence sheet. You put it under his arm like that. Okay. Apart from that, you're going to get a tourniquet. When you get a tourniquet, you're going to tie a tourniquet right there. So since it's for assessment, you're going to first tie it very hard so that you assess for a vein. So since you can see a vein, you're going to loosen it. You make it tighter as you come back after you scrub. So just loosen it after you locate a vein. So you leave it like that. Another thing that you should do is to prepare strapping. So you're going to prepare strapping. Okay, you're going to put it on the side of the trolley like that, meaning that's for securing the cannula. Then the last, you're going to get the cannula itself and open it. So you can open it in such a manner that you drop it on the receiver like that. So it's on that receiver. Or if it falls on the sterile field, don't worry, it's not contaminated. It can fall on the sterile field. Okay, so at this moment, my preparation is done. I have to scrub. So scrubbing, you follow again the OSC rules. You go. So you're going to go like 1, you come out. Then 2, you come out. Then you get your soap. Then you just do 1, 2, 1, 2, then 1, 2. Then from there you go up to your elbow. Then from this other arm as well, elbow. Then you have to remove the soap. So from there you go, but you have to be very fast. Then there as well you go. Then you close the tap. From there you dry your hands and arms. So you go. So first corner from the tips of the fingers there, that's what you put. This is the first corner. So from there you go, then in between the fingers, then you go up to here. So that's the first corner, from there to there. And then second corner behind, so you turn, then from the tips of the fingers like that, then in between. So you go in between so that your fingers are also dry, like that. Then you go up to your elbow. Okay. Then third corner, which is here, you turn. It has to go now to this part of the palm. So tips of the fingers, then you go in between, okay, until you reach here. So that's your end point. Then you go to the last corner. So you have to see you rotating like that. So that's third. Then fourth corner, like that. Then you go from tips of your fingers there, and the tips. Then you go in between the fingers. Then you go round until you reach the elbow. From there you fold it. Then you bend a little bit. You can bend and throw in the basin. At this moment, you have to glove up. So the way you glove up, the way the gloves are folded, you glove up like this, where you hold this part here. So the way the gloves are, you have to hold here and then slide in your hand. Okay, look where I'm holding here. So this is the inner part, so it goes like that. Then the other side, I will go in like that. If you check out, I will go like that and then glove up like this. That's how you glove up. Then this time you can touch this part. Parts of the gloves can touch each other like that, but not with your bare hands. So this can touch. Then at this moment, I will get my drape. These two corners, as you can see, these two flaps. Then from here, be able to unfold. So I can rotate and drape. So while I drape, then I have to ensure that this part for cannulation, this part is exposed, but the tourniquet is hidden. So at this moment, you know where you tied your tourniquet. You can now pull the tourniquet. So I'm pulling the tourniquet so that it's tighter. Okay? At this moment, you can pull using this drape. So I've pulled the tourniquet and the tourniquet is tight, and I can leave it like that. So I have to get now the swabs. So I can get even two, like that, spirit, then put in. Then bring this closer, get the swab, and drop here. Then at this moment, I located my vein here. So this is the vein I'm going to use to cannulate. So we just swab, a big swab, like that, once, then you discard. In case it's not clean, you can get another swab to clean the site again, drop, and then swab. So once you do the swabbing, now you can get the cannula itself. So the cannula has these flaps. You can drop the flaps like that. They were like this. So you can drop the flaps so that you hold the cannula properly. Then remove this plastic piece. This piece, you remove it. Then you can just drop it there and hold the cannula like this. Once you hold it like that, you're going to make sure that you hold the arm, you support, and then go in that vein which you located. Once you push in like this, you see blood coming back. Then you can start pushing the flaps while drawing this part here. This part has the metal part. So while you push the plastic, you pull out the metal part. You keep doing that until this part of the plastic is more like in contact with the skin. Then you can remove this metal part. But then if you remove it completely, you find that blood will drain. So you have to get this cap. You get this cap here. You remove it. And then you press there where the plastic part is ending. Then you remove this piece. This piece can go straight into the sharps box, or you can place it on that receiver. Then cap the cannula like that. Once you cap it like that, meaning blood won't be able to drain. At this moment, you can either flush it with normal saline or use your IV fluid which you have. So at this particular moment, we'll strap it. So you have to just secure it. You can either use your assistant to secure it or you can secure it yourself. Okay. So you can get the strapping and secure the cannula. So you can secure it in so many ways. You can use your own style. You can flap here. You can put the strapping on the flaps, or you can start with that, whichever way you're comfortable with, as long as this cannula is nicely secured. So at this moment, you can connect your IV fluid, or you can put your drugs and flush with normal saline. So I'm done with cannulation. So what you do is need to loosen this so that it's not really causing any problems with the patient. So Mr. Mlenga, thank you very much for allowing me to insert the cannula on you. I was inserting the cannula so that you receive medication and also IV fluids. So you can even remove these things here, the ankle sheet and the drape. So you have to just keep it safe so that it doesn't come out again. So at this moment you're done with your IEC, so you can go to the in-charge. My in-charge, I've inserted the cannula on Mr. Mlenga and I've left him comfortable. Okay, so thank you very, very much. I will document. So at this particular moment, you can take off your gloves and discard there. then go and wash your hands. So as usual, Osk, then you do that, 1, 2, 1, 2, 1, 2. Then rinse and dry. Okay, so thank you very much for watching, and you should keep practicing so that you get acquainted with the style of cannulation. Thank you.